A stiff back? Oh, that's too bad. Oh, no. Good afternoon, everyone. I'm going to call to order this meeting of the Health, Environment, and Community Engagement Committee. My name is Cam Gordon, and I'm chair of the committee, and I'm joined today by council members Fry, Bender, and Glidden. I believe council member Andrew Johnson should be arriving soon, but we're a quorum of the committee, and we can do the city's business. We have two items on our agenda today. Both of them are public hearings where we will be considering ordinance amendments. The first one is having to do with grocery stores and specialty food store ordinance amendments. And we're going to have a presentation, and then we'll have a public hearing on this. And we'll do the same thing with the second item, which has to do with short-term food permit ordinances. And just as I predicted, Councilmember Johnson has arrived. All right, I think we'll start with the presentation, then with our grocery store ordinance, and I believe that Gretchen Musicant's going to start that. There, didn't see you there.
Good afternoon.
Welcome.
Just so that I'm in the same order as our sheet there. 2, 3, 4. Okay. It's my pleasure to be here today to give you a little context for the amendment to the ordinance that you'll be considering today. So, as you may realize, in the community, there is a growing demand for healthy food. And we've seen that in community feedback, including surveys at corner stores that indicate customers would like to have access to more healthy, affordable options in their neighborhood stores, especially fresh fruits and vegetables. And in fact, in 2013, we found that 94% of corner store customers would like that option. But we also know that opportunities for accessing healthy foods are not equitably distributed across the city. While some residents, including where I live, we have easy access as residents. We have easy access to abundant selections of healthy foods in traditional supermarkets and co-ops. And we also find, however, that other residents must rely on corner stores, gas stations, dollar stores, and pharmacies to meet their grocery needs. In many of these second stores I have mentioned, it's easier to find pop, chips, candy, and even strawberry-flavored tobacco products than it is to find actual strawberries or other healthy options. We know that limited access to healthy food is linked to poor health outcomes like obesity, diabetes, heart disease, and stroke. And we also know that in Minneapolis, there are significant health disparities in low-income populations, as well as indigenous communities and communities of color. These same groups have the most challenging time finding healthy foods in their neighborhoods. And the picture here is a really abundant display that you might find in one store, and then some of the produce that is low in quantity and perhaps low in quality that is found in others. So as part of this growing interest in healthy food, we know that there are lots of folks involved in trying to make this happen. There's really a widespread movement in Minneapolis to increase access to healthy foods and promote healthy eating. These include policies in various entities like local governments, parks and schools and work sites. The implementation of electronic benefit transfer options at farmers markets, growth of community gardens, more healthy food in food shelves and at meal programs, farm-to-school programs. You all adopted, or your predecessors adopted, an urban agriculture policy plan that lays a framework for development of more healthy foods options in the city. We have an initiative helping restaurants improve their menus so that they are more healthy. And there are many cooking classes and nutrition education programs. So it is within that context that we look at modifying our staple foods ordinance today. It's just one piece of a broader approach to increase healthy food options for all Minneapolis residents. We know that healthy choices start at home, but communities also need to come together to support residents' efforts to live healthy lives, and this is part of making those options easier for everyone. So in 2008, the city really did something that was groundbreaking and created a staple food ordinance. It required 5 varieties of fruits and vegetables, 3 varieties of dairy beverages, 3 varieties of bread or cereal, and 3 varieties of meat, poultry, fish, or vegetable protein. One thing it did not do was say how much, and so you'll see this basket to my right and to your left. This would satisfy the requirement for the 5 varieties of fruits and vegetables in a store. And if you went into a store, you might think, wow, if I take some of those, what's left for everybody else? So the 2008 ordinance requires licensed grocery stores in Minnesota to sell a small amount of this basic food in the 4 categories. It defines licensed grocery stores as more than just traditional supermarkets or co-ops that you might think of. They also include other types of stores that sell food, like gas station, dollar stores, and pharmacies. But it also exempts some stores, including specialty stores, stores located in the central commercial district, and gas stations that have less than 300 square feet of total retail floor space. Some of the issues that we've heard about and discovered with our current ordinance is that there is no minimum quantities within each category, hence the basket with only 5 items in it. There is an insufficient guidance related to acceptable levels of fresh produce quality, and so we are hoping to add that. And then there's some ambiguity in the language around specialty food store exemption, and so there will be proposed modifications to deal with that. I'd like now to turn it over to Kristen Klingler, and I'm thinking, did I introduce myself at the beginning? Perhaps not. Gretchen Musicant, Commissioner of Health. Kristen Klingler is going to talk to you about some of the things that we've done to help implement that 2008 ordinance, and then some of the changes that are being recommended today.
Thank you, Commissioner. Welcome, Ms. Klingler.
Good afternoon, members of the committee. As Commissioner Musicant mentioned, in 2008, Minneapolis was the first city in the country to adopt such standards for licensed grocery stores. And while we remain the only city in the country to have such requirements, our standards have actually been surpassed by the Women, Infants, and Children, or WIC program, the Federal Nutrition Assistance Program. In 2010, WIC adopted more comprehensive guidelines in 14 food and beverage categories, and they set minimum amounts and varieties within each category and included some very specific requirements. At the time, there were concerns from business owners that the new WIC standards would be too difficult to meet and would cause stores to drop out of the program. However, research looking at national trends since the guidelines were adopted in 2010 have actually shown no evidence that stores have stopped accepting WIC or that they've lost their WIC eligibility. Instead, after a transition period, we've seen stores add inventory and infrastructure and report increased sales of healthy foods. We've also seen that customers have bought healthier foods and drinks, and that WIC families are eating more healthy foods. At the same time, we've also observed some pretty exciting trends in the national childhood obesity rates. They've started to level off in many areas. And while WIC can't take credit for this completely, it is definitely part of the bigger picture that has helped to drive those numbers down. So given the positive outcomes that are associated with the higher WIC standards, we feel that there's an opportunity to strengthen our ordinance language and achieve similar results here in Minneapolis. And this can be a key part of the broader approach that Commissioner Musicant mentioned and help us to address some of our health disparities and inequitable access to healthy foods. So while the WIC changes are good, they only apply to about 33% of the licensed grocery stores in Minneapolis. We need standards that apply to all of our licensed grocery stores. And it's not as simple as implementing the WIC guidelines in all of our licensed grocery stores. We feel that store owners in Minneapolis need more flexibility in order to meet the dietary requirements of some of our indigenous communities and cultural groups. So what we did is use the WIC standards as an inspiration and a starting point for conversations with store owners and other key stakeholders. And as a result of their feedback, which I'll describe in more detail later, we've made many modifications to try to reduce the burden on store owners and allow for maximum flexibility in choosing what to stock so that they can best meet their customer needs. So we're proposing 4 key changes to the current ordinance. We'd like to expand the required number of staple food categories. We'd like to set minimum quantities within each category. We want to provide better quality standards for fresh produce and perishable items. And we want to clarify the specialty food store exemptions. So for that first change, we're proposing to increase the required food categories from 4 to 10, as outlined here, to ensure a more well-rounded selection of nutritious foods for customers. And again, these were inspired by the 14 WIC categories, but modified to reduce the burden on stores. Within the 10 food categories, we propose to set very reasonable minimum quantities. Take the fruit and vegetable category, for example. Without a minimum quantity, stores can technically meet the current standards by stocking the contents of this single basket that Commissioner Musicant referenced earlier. We're proposing that stores stock 30 pounds or 50 items total in 7 varieties, of which 5 must be fresh, but 2 could also be frozen, and no more than 50% from a single variety. These 2 baskets on my left show what this reasonable amount of produce looks like. And if a store owner were to purchase this amount of produce at wholesale cost, it would only be about $21 to meet the proposed requirement. And in many other cases, we lowered the minimum quantities to address store owner concerns. For example, we decreased the milk and milk alternatives requirement from 15 gallons down to 5. We decreased the whole grain cereal requirement from 12 boxes down to 4, and decreased the 100% juice requirement from 18 containers down to 6. And these changes were all made to ensure that store owners did not have a burden on them, that we were providing a reasonable amount of food, and that they had as much flexibility as possible within each category. So if you do a side-by-side comparison of our current requirements, the proposed requirements, and the WIC standards, it's easy to see how we're raising the bar, yet not going as far as the WIC standards. So again, we're increasing the amount of healthy food required in these stores, but are in all cases allowing for more flexibility than the WIC standards. So to address the issues with quality of perishable items, we're proposing more detailed standards for any item that a store wishes to count towards their staple food requirements. So perishable items must be in good condition, not overripe or seriously deformed, and free from decay, discoloration, bruising, and surface damage. And finally, the fourth change, in order to set a consistent standard across all types of grocery stores, we propose to eliminate the vague specialty food store definition and replace it with an accessory use category. And you can see here that accessory use grocery is defined as a store that sells staple foods as an accessory to their primary business, or sells only specialized types or classes of food, and does not accept federal supplemental nutrition assistance programs, SNAP or WIC. I'll go into this in a little more detail on the next slide. In addition, we want to maintain the other 2 exemptions from the current ordinance for stores in the central commercial district and gas stations under 300 square feet of total retail floor space. So to reiterate, a store can qualify for an exemption from the staple food requirements if they can demonstrate that they are an accessory use grocery, which means they sell only special types or classes of food. They sell as part of another food as another part of their primary business, and they do not accept SNAP or WIC.
I'm just going to interrupt because a council member has a question. Councilmember Fry.
Thank you, Mr. Chair. Yeah, I have a couple questions on this exact topic, and maybe I should wait just a little bit longer because you may answer my questions in a minute. Are you done with sort of the accessory use grocery store definition?
Mr. Chair, Councilmember Fry, no, I'm actually going to provide some examples of the types of stores that would be exempt and would not be exempt, so that might answer your question.
Okay, Mr. Chair, if it's all right, I'll withhold my question for a little bit.
Okay, thank you. Go ahead.
So a store could say, I'm not a grocery store, I only sell imported foods, or I'm not a grocery store, I'm a gas station that happens to sell food. With the accessory use definition, we can more easily determine whether or not they should be exempt. The key is whether or not they accept SNAP or WIC, because a store should not be able to say on one hand that they are a place where people can use their government dollars to purchase groceries, and then on the other hand, say that they should be exempt from stocking staple foods because they're not a place that sells groceries. We think that you can't make both arguments. So for example, a store that only sells certain types of foods, like a spice store or an olive oil store, and does not accept SNAP or WIC, would qualify as an accessory use grocery, and they would be exempt from the staple food requirements. As another example, a gas station or a pharmacy that sells food in addition to their primary business and also does not accept SNAP or WIC could also be considered an accessory use grocery and would be exempt from the staple food requirements. For non-exemption examples, which most stores will not qualify for the accessory use grocery, and I can tell you how many exactly in just a second. As you might expect, stores that are selling mostly food, like traditional supermarkets, co-ops, and most corner stores, would not be considered accessory use groceries, and they would not be exempt from the staple food requirements. Gas stations, dollar stores, pharmacies, and other general retail stores that sell food in addition to their primary business and also accept SNAP or WIC would not be considered accessory use groceries and therefore would not be exempt from the staple food ordinance requirements. So to summarize, if your primary business is selling food, then you have to meet the staple food requirements. There aren't exemptions. If your primary business is something else, or if you're selling only a narrow type of food, you may be exempt as long as you're not accepting SNAP or WIC. So we've worked.
Okay.
Thank you, Mr. Chair. So am I to assume that that every single time it says all grocery stores within the ordinance amendment, that would include all accessory use grocery stores that are not using SNAP or WIC?
Mr. Chair, Councilmember Fry, when it references all licensed grocery stores within the ordinance, that is all stores that are not classified as an accessory use grocery.
So it would include gas stations that are using SNAP and WIC within the grocery store definition?
That is correct.
Is there a reason that we don't explicitly say that within the grocery store definition?
Mr. Chair, Councilmember Fry, we wanted to try to clarify the language, but keep it as close to the current ordinance as possible. So we thought the key defining factor was the EBT or the SNAP or the WIC language, whether or not they accepted that.
I just wanted to be clear that that if you're not in accessory use grocery store, you are a grocery store, and there's no gray area in there in between. So that they can somehow fall out.
I would refer to Councilmember Gordon for advice on how best to address that within the language as the author.
I think that it's pretty clear, either you're an accessory use grocery or you're a grocery store. And when it says that the grocery store shall provide, that's not the accessory use. But I'm willing to, we can certainly look at that. And this is something that got a lot of discussion in the course of the 24 months while we were working on this. And settling on the federal program actually carved out a really clear way to be really clear about it. If you're telling the federal government you're a grocery store and you're going to accept the federal program funds to do it, that made it easier on us. We looked at a lot of other things, including how much actual square footage of shelf space you dedicated to food or not, and all these other issues. This does make it clear that the really small gas stations that don't have much retail space at all are definitely exempt. And I think Councilmember Glidden has another question on this point.
Thanks, Mr. Chair. I think you just answered this, but I actually had understood the law a different way. So if you also sell gasoline, then by definition you're an accessory use or you're a grocery, because that makes a difference then to how this applies.
Mr. Chair.
right?
Chances are a lot of the gas stations are groceries under this, terms of this, because they'll be larger, they'll have larger than 300 square feet of retail, and they'll be accepting federal dollars to sell food. And that's what tips the gas station into being a grocery store. And so they'd have to be licensed as a grocery store, and it couldn't be an accessory use. If they didn't take SNAP or WIC or EBT, then they would not be considered a grocery store. But right now, most of them, I believe, do. But
So gas station, in our current definition of licensed grocery stores, that includes gas stations, dollar stores, pharmacies, other general types of retail stores that sell food. They have a licensed grocery, they have a grocery license currently. They could be considered an accessory use and exempt from the staple food requirements if they meet the accessory use definition, which some of them may if they're not taking SNAP or WIC.
Then my other question was, because in your description of how you've decided on what combination of food items would be the required items for a grocery to carry, it seemed like you were pegging this primarily to the WIC requirements, but you're also saying if you accept SNAP or other forms of assistance, that also would mean then that you would need to carry this variety of food items that would be in the proposed ordinance amendment. So, but you haven't told us how SNAP maybe compares to WIC. Is it, and I think we're just here as receptors to understanding those issues. I'm just trying to understand, since you've pegged it all to WIC, how that then compares to the SNAP requirements and so forth.
Mr. Chair, Councilmember Glidden, thank you for that comment. The WIC requirements are very comprehensive, and so we use those as our inspiration and as our starting point for the conversations. The SNAP requirements are actually less stringent currently than our current Minneapolis standards. So we really weren't looking to go backwards with this. We wanted to be more aspirational and look towards the WIC requirements and what the breadth and the quantities that they required for nutritious food items.
If you're a business, are you required, if you accept SNAP, to accept WIC too?
You are not. They are independent programs.
Okay, so then it was more just a choice to peg it to the highest requirement program.
That's correct. We wanted to have a broad amount of nutritious food options available, and WIC offered a good starting place to look at what those standards might be.
Okay.
Thank you, Mr. Chair. I wondered if you might, just since we're talking about this, return to slide 14, because I think you went through it kind of quickly, and I'm looking at it myself and seeing that actually there's a pretty significant difference between what we're proposing in our new standards and the WIC standards.
Is this the slide you're referring to?
Yes. Thank you. So I think you said this in your presentation, but I just wanted to clarify. We're sort of halfway between WIC and our existing standards with these new proposed standards. Could you just kind of describe that more in this slide?
Sure. Mr. Chair, Councilmember Bender, yes, we are falling kind of in the middle of our current, what we consider very minimal requirements for staple foods and the very comprehensive and sometimes very stringent requirements of WIC. The chart, if we had time to go through it in detail, would show that for many categories, WIC sets very specific requirements that we thought were too inflexible for our store owners here in Minneapolis. So in all cases where we modified our standards from the WIC standards, we were moving in the direction of more flexibility. And a lot of that came from talking directly with store owners about their concerns. So for example, modifying the milk category from 15 gallons down to 5. So it's higher than what we currently have, but it's not quite the reach that WIC would be. Mm-hmm.
thank you. Why don't you continue?
So just one more point then on the accessory use stores versus the non-exempt stores. There are about 330 licensed grocery stores currently in Minneapolis. We're anticipating about 68 of them would be considered exempt because they're either an accessory use grocery, a gas station under 300 square feet, or they're located within the central commercial district. That would leave about 262 stores that would be required to meet the staple food requirements. And those are stores that are primarily selling groceries, and also those retail stores, gas stations, and general stores that are accepting EBT or WIC and therefore not qualifying for the accessory use definition.
Councilmember Glidden has another question.
Thanks, Mr. Chair. I had a question about something that I understand was in the ordinance proposal before it made it to its form that we are seeing today, and why that was removed. So maybe you can tell me some history. So I understood that there was an exemption proposed at one point that was for shopping centers. And maybe I misheard that, but I thought that there had been an exemption proposed for shopping centers, again, because of what might be some unique challenges around making those spaces work. And so as an example, in the Midtown Global Market, I think they probably have about, I don't know, upwards of 5, I know, stores that hold grocery licenses. So maybe you can address that for me. Was that originally in the proposal? And if so, why was it removed?
Mr. Chair, Councilmember Glidden, to my best recollection, that was not in the original proposal that you saw last year. There is a current exemption in the ordinance for stores located within a shopping center, and that exempts them from the parking space requirements and the minimum store square footage requirements. So if shopping centers came up, it was probably in that context that we were keeping that current requirement. For the other types of grocery stores, even if they're located in close proximity to another food outlet, we want them all to meet consistent standards so that people, regardless of where they choose to shop, can find an appropriate amount of healthy foods.
Okay, thank you.
So I just wanted to make one more point about this slide, is that many of the non-exempt stores are already meeting the proposed standards. Supermarkets, co-ops, big box retailers, the WIC authorized stores. And according to data that we collected in partnership with the University of Minnesota earlier this year, many others would be able to meet the proposed requirements with only minor tweaks to their inventory. So as we developed the details of these 4 proposed changes, it was very important for us to solicit feedback and ideas from the store owners that would be most directly impacted. So over the past 2 years, we've shared drafts of the changes and gathered feedback in a number of ways, including meetings and presentations to store owners and business associations. Most recently, we mailed a summary of the proposed changes to all licensed grocery stores and invited them to 2 formal industry meetings that we held this summer. And as a result of those meetings, we considered many of their suggestions and made changes to address the concerns, as I've outlined previously. And prior to this hearing, we also sent a summary to all of the industry meeting participants about how their feedback was incorporated into the draft language, and we notified store owners of the public hearing and the proposed changes via an e-newsletter in October. So if adopted by the City Council, staff from the Minneapolis Health Department's Environmental Health Division and the Healthy Corner Store program will lead a 3-phased implementation process. Staff from both teams have been working very closely together on the development of the ordinance language and are ready and willing to help with the implementation of this plan. Phase 1 starts in January of 2015 and focuses on communication of the changes to store owners and to residents. In April of 2015, the ordinance changes would go into effect. For the entire first year, we would focus on education and training for store owners, making sure they understand and can meet the requirements. There would be no enforcement activity taken during this first year. In April of 2016, we plan to start enforcement activities, along with continuing the ongoing education and training opportunities to make sure that stores have every opportunity to be successful at complying with these standards. So Health Department staff are well positioned to support stores in learning how to successfully comply with the new ordinance requirements. For the past 5 years, as many of you may be familiar, we've run the Minneapolis Healthy Corner Store program, which has worked with over 35 stores to make healthy foods, specifically fresh fruits and vegetables, more visible, available, and affordable for customers. These are 2 examples of our stores that we've worked with that are successfully selling foods like fresh fruits and vegetables. We have Cedar Food and Grill in South Minneapolis, indicated in the top picture, and Pantry Foods in North Minneapolis on the bottom picture. A 2013 evaluation of sales data showed that participating stores were actually increasing the number of fruit and vegetable transactions and their fruit and vegetable sales as a result of working with us on these basic strategies. As a result of our Healthy Corner Store program experience, we feel that we're pretty well acquainted with the types of challenges that store owners might initially face when adding healthy foods to their inventory. We recognize that some small stores may encounter some initial difficulties in meeting the new standards, which is why we're prepared to offer a variety of services, training, and assistance to address these issues and increase their chances for success. So for example, if a store is unsure about how to effectively handle and display fresh produce, we will offer healthy food merchandising trainings and free promotional supplies. For stores that need help finding wholesale sources of fresh produce, we'll connect them to procurement options, including local growers and small-scale distributors. And for stores that need to add refrigeration in order to safely store perishable items, we'll connect them to low-interest loans here at the city to help them with those equipment costs. So as we roll out the ordinance changes over the next 2 years, a team of researchers at the University of Minnesota, led by Dr. Melissa Laska, will be conducting an objective evaluation of the ordinance and its impact. So I'd like to turn it over to Dr. Laska so that she can explain a little bit more about that process and how it can help us evaluate our efforts. And then if there are further questions, we'd be happy to take those.
Okay, thank you very much. Welcome.
Good afternoon. My name is Melissa Laska, and I'm an associate professor at the University of Minnesota School of Public Health in the Division of Epidemiology and Community Health. My area of expertise is in public health nutrition and obesity prevention, and I also do work related to food access in communities. My team at the university is prepared to support this work by conducting a third-party evaluation of the effectiveness of this policy revision on health. This evaluation would be supported by federal funds, namely funds from the National Institutes of Health and the Centers for Disease Control and Prevention that we've applied for and have been approved for funding pending the passage of this policy revision. The aims of our work would be several-fold. You see them here. We'd be looking at changes in food availability in stores, customer perceptions and what people are actually purchasing in these stores, as well as issues perceived and things reported by store owners and managers, particularly in small stores, and also healthy home food availability among frequent small store shoppers to see if these healthy food availability in the store is translating into healthy home food availability. We'd be doing evaluation both before and after the policy revision, and we'd be doing evaluation in Minneapolis as well as St. Paul as our control community. Our evaluation would go up to 2 years following policy implementation, so we'd really be able to see how this policy kind of rolls out over time and its impacts. And finally, we'd be able to provide timely feedback to the city to really help inform any adjustments or technical assistance changes or future action that might be needed in this area. So in closing, I'd just like to say that my team and I are really looking forward to the opportunity to potentially study this policy and its impact on the community. Thank you.
Well, thank you very much, and I think this is a very exciting opportunity in partnership with the university, and I wish we could do this with all the ordinances we pass, because we try to think we're doing the right thing, and sometimes it's hard to know, and we're always biased if we do our own research too. So I really appreciate that you took the initiative to look into this and even secure some funding, and you've come forward with this offer. I think it will then also inform us if we think we need to improve or change something afterwards. Now, are there any other committee questions before we open the public hearing? Councilmember Glidden.
Yes, so I'm going back to this new definition of accessory use, and I'm looking at what would be changed and eliminated by, or replaced, I should say. And so one of the things that is changed with this new definition is the definition that exists for specialty food store. And I was involved in helping create that definition of specialty food store to address some challenges that certain stores had, primarily in shopping center areas in Minneapolis, where they wanted something more than a confectioner's license, but did not really have space that made it appropriate to have a grocery store license. And these would be typically some stores that might sell some staple foods. So one thing that's eliminated by changing this out with the accessory use grocery definition is there was a prohibition on those specialty food stores from selling tobacco products. And that now is not incorporated into the new definition. So was that your intention, to eliminate that prohibition on selling tobacco products at specialty food stores?
Mr. Chair, Councilmember Glidden, that was not our intention. I don't know that we removed that language, so I need
It's
a little
removed
more.
right here. There's a crossed out. So if you look at the definition of specialty food store and you read that definition, within that definition is a sentence that says such an establishment may not sell tobacco products. And so that was a prohibition that was specific to this specific store as defined.
Mm-hmm.
And by eliminating that language, then you have removed that distinction for those stores.
Mm-hmm.
So
I
I'll
think-
just point that out.
Feel free to
That's one thing. I think a second thing kind of goes back to my question about having the requirements be all pegged to WIC. When again, you have some establishments, and again, this is why, as I recall, the specialty food store was created so that you would be able to allow some stores that had unique space constraints to sell more than what you would get with a confectioner's license, which is pretty restrictive, and that is, like your candy, and anyway, those, I think you can imagine what those items might be. And they might want to sell some other foods that would go along with a theme of certain types of products.
So maybe I could just respond. Two things. The issue of tobacco products is very interesting. I think that was an unintended consequence. It was something that got added into the specialty food store amendment that maybe was appropriate to prevent that from happening there. Definitely some of the accessory use groceries would probably still be able to do it, but it's something to look at, and I'd be open to an amendment there if we could figure out a way to put that in there. And I do want to clarify, although we used the WIC standards, this is on your other comment, they aren't really pegged to the WIC. I mean, the new standards aren't pegged to the WIC standards. In fact, one of the things that we did was we tried to open it up so there was no, there were general categories, but it could be culturally flexible to accommodate.
But it's higher than the SNAP standards.
Definitely.
Right.
SNAP standards.
So that's kind of what I'm saying is that, and maybe that's why I asked, because I wanted to make sure I'm understanding where the standard lies. I'm certainly no expert on WIC versus SNAP or any of that. So again, just trying to understand that. And then if I could ask one final question is, has there been an analysis of what it will take in terms of staff time to implement this ordinance? And I just say that because one of my concerns about the ordinance isn't about how do we try to ensure grocery stores are offering an appropriate complement of healthy foods as opposed to processed and other types of items. But it is pretty complicated. I mean, just reading it, it's pretty complicated. And now there's also some standards that have to do with food quality and all those things. I'm not saying that's inappropriate, but it's a complicated ordinance from a department that came to us just a few months ago saying that they felt they didn't have enough staff to meet their existing priorities. So how have we analyzed our ability to appropriately staff this? Because I think these stores will need a good amount of assistance, as you were saying, education and assistance on how to meet some new standards.
Mr. Chair, Councilmember Glidden, yes, we've been working very closely. So we have, within the health department, we have a Healthy Corner Store program staff, as well as our environmental health division of the health inspectors who go out on a regular basis to inspect stores. Both teams have been working very closely to talk through the implications of the ordinance changes and what that would look like during the phased rollout process. We have some great resources that we can rely on to help reduce the burden on our internal resources, at least. And one of those things is we would look very closely to the researchers at the University of Minnesota. They are currently, they have experience with collecting and assessing stores on these proposed requirements, and they have been able to streamline the process so that it does not take very long when the inspectors would be out in the stores. So we would look to them to help teach our staff and our inspectors how to do this quickly and efficiently with minimal interruption to the stores. And we also have some grant funding in place that helps to fund the Healthy Corner Store program that would allow us to put some staff time towards this, as well as the materials and the resources that I outlined earlier. So the free promotional supplies, the trainings, those types of supports will be in place. And we're continuously seeking additional funding and support to help
So that's
expand those efforts.
helpful, but what I hear from that is we're still kind of assessing what the staff time will be.
I think it's certainly not.
Okay.
We know that it won't be too burdensome on the inspectors because of the experience of the University of Minnesota teams that have gone out and assessed the stores on these same standards that we're looking at. So we're basing our information and our projections on their experiences, but we have not sat down and done any training with our current team of inspectors and had them go out and do any.
Okay, and that's fine. I mean, that's, I just sometimes when these ordinance changes come forward, there's a staff assessment of it's going to take X or Y or whatever it is. So thank you.
And I'll just point out that we have already had grocery store licenses. We already should have been inspecting for them. I think it was already a challenge sometimes. We discovered as I dug into this that all of them maybe weren't getting inspected as much as we wanted, but just because we've modified the ordinance doesn't mean that we're going to increase the number of stores and the number of inspections that might be necessary. I see there's one more, or at least one more question. Councilmember Fry.
Thank you, Mr. Chair. So well, let me preface everything that I say with I'm very supportive of this initiative, and I think you're doing a great job. I just want to make sure we've got the definitions right, and I may be misunderstanding this right now, but here's my concern. We've got this overarching category which includes grocery store. It's my understanding that accessory use grocery store is a subset of that, or at least that's how we intend it to function, that is then exempt if they are receiving, or not, I'm sorry, if they are not receiving government funds. Is that correct?
Mr. Chair, Councilmember Fry, that's one component of what could make an accessory use store.
So here's my concern. It is a grocery store by definition. So a retail establishment that sells such products as staple foods, accessory food items, etc. They then fall into the accessory use category because they're selling staple foods as an accessory use to its primary business. They are using government funds. What then brings them back into the definition of grocery store to come so that it's enforceable under 20320, which is the requirements?
So they are only able to apply for an accessory use exemption if they are selling a specialized type or class of food, or selling food as an accessory use to their primary business, and they don't accept SNAP or WIC. If they meet those criteria, they go into the accessory use grocery category, and they're not held to the staple food ordinance standards. All other stores that have a grocery license that can't justify that accessory use definition are considered grocery stores and held to the staple food standards.
Okay, so if it's an accessory use grocery store, it does sell SNAP or WIC. We recognize that it says here, the definition of accessory use does not include stores that accept governmental supplemental nutritional programs. So that gets them out of the accessory use grocery. I just want to be sure then that those stores are included within the definition of grocery store. So I don't want them to be able to say, I'm an accessory use, but I'm relieved of that requirement. I'm sorry, I'm an accessory use, but I do accept these government subsidies, but I don't somehow fall back into the definition of grocery store.
They are not able to claim the accessory use definition if they are selling food in a specialized class or type, or if they're selling food as an accessory use to their primary business, and they're accepting SNAP or EBT. They can't even get into that category to begin with.
Okay, so but the absence of their failure to fall into one category necessitates their inclusion in the other, which is grocery stores?
If they are not able to demonstrate how they meet the accessory use criteria, then they will continue to be considered just a licensed grocery store.
Okay, that answers my question. Thank you.
Councilmember Bender.
Thank you, Mr. Chair. Can you clarify that the kind of catch point for this, the initial catch point for this is through their business license application? Is that correct? And so someone would apply either for a grocery business license or an accessory use grocery license. Am I understanding that correctly?
Mr. Chair, Councilmember Bender, I believe that's the case, but I would defer to someone in business licensing or environmental health inspectors to confirm that.
Because we currently have a grocery business license and a grocery specialty store business license application, which are two different business license applications. So I'm assuming what we're doing is maintaining the grocery business license, and we are replacing the grocery specialty store license with the accessory use grocery license.
That's correct, yes.
Okay, thanks.
I don't see any other questions.
Thank you.
Thank you very much for the presentation. There maybe there'll be some later. Stick around. I would like to open the public hearing then, and I'd like everybody to know that there are 20 people who have signed up to speak today. Overwhelmingly, they've indicated that they're supportive. And so when you're speaking, just keep that in mind. If everybody spoke for 2 minutes, that would be 20 minutes or so, although there'll be space between the speakers, and if 3 minutes, it would be 30. So try to aim between 2 and 3 minutes, and I think that would be very appreciative. We'd appreciate that. People would appreciate it. But say what you want to say. The first person is Russ Henry, and Sarah Noor is the second to get ready.
Thank you, Mr. Chair and esteemed council members. My name is Russ Henry. I'm the co-chair of Homegrown Minneapolis and a resident of the 12th Ward. At the Homegrown Food Council, our job is to recommend policies that will make it easier to grow, buy, and eat healthy foods in Minneapolis. Through our extensive community engagement efforts at Homegrown, we have repeatedly been impressed that Minneapolis residents tend to view access to healthy food as a justice issue. Access to healthy food is a shortcut to personal health, and for most Americans, personal health is one of the greatest factors in determining economic stability. From this vantage point, it's clear that access to healthy foods is directly related to the financial well-being of Minneapolis residents. As a part of our work over the last few years, the Food Council has lent a hand in the development of the Staple Foods Ordinance. In fact, this issue is so important to the Food Council that we have a subcommittee dedicated to working on it. The Food Council has performed outreach and research to help determine the Staple Foods Ordinance potential impact on local businesses and communities. I'd now like to read to you from a letter sent to the Honorable Council President, Barb Johnson, and written by Mike Asum, a local business owner. Mike writes, I am the owner of Fremont Market on Fremont Avenue in North Minneapolis. My store serves many customers from the surrounding neighborhoods, many of whom rely on food assistance programs like EBT and WIC. Residents in my community need more places where they can buy high quality, affordable food that is both convenient and good for them. I am committed to offering my customers nutritious foods, including fresh fruits and vegetables, because I believe this will improve their health and help meet the needs of the community. Mike continues, although selling healthy foods can be hard at first for small grocery stores, I think it is possible for stores to learn how to comply with the new staple foods requirements and be successful. As a participant in the Minneapolis Healthy Corner Store program, I have received assistance from the Minneapolis Health Department that has helped me increase the amount of healthy foods available in my store. With their support, I've learned how to manage my inventory more effectively and am able to meet my customers' demand for healthy items while generating revenue and reducing food waste. Mike concludes, with the city's support, other small grocery stores will be able to meet the new ordinance requirements and offer more fresh, healthy foods to their customers. I hope the City Council will vote to adopt the new requirements and make healthy foods more available for everyone. Sincerely, Mike Asum, owner of the Fremont Market. Honorable Council members, I share Mike's point of view. Healthy food access is a win for residents, it's a win for neighborhoods, and it's a win for small businesses. Thank you for considering the Staple Foods Ordinance.
Thank you.
Good afternoon. My name is Sarah Noor, address 425 Riverside Avenue. I'm a public health nurse and the CEO of People Center Health Services, which is a community health center serving a lot of immigrant and low-income families. And I represent, I'm here this afternoon to represent the City of Minneapolis Public Health Advisory Council. The council would like to submit this letter in enthusiastic support of the proposed amendments to the city's current stable foods ordinance. As a citizen advisory committee whose members have knowledge of public health issues, PHAC takes a special interest in the food supply available in our city. We believe that enhancing existing stable foods ordinance makes sense in the city's efforts to address availability and disparity issues associated with access to healthy foods. We see this as part of a bigger initiative and policy changes that we're proposing to the Department of Health in looking at how do we keep the residents of Minneapolis healthy and vibrant. So there are three reasons that we supported when this proposal was brought to us. One is because it's evidence-based. It supports identified community need, both locally as well as nationally. The second thing we support is I think we've been really pleased with the fact that the department has spent a lot of time talking to the industry, talking to people that are directly impacted by this amendment. So that was really something that we were very pleased with and really gave us a rationale for supporting it. And the third, I think, is when you really look at what's happening in the city, you have neighborhoods that are really struggling and don't have access to a large grocery stores where this is where these fresh foods and vegetables are accessible. So requiring these convenience stores and gas stations to have basic fresh fruits and vegetables on a daily basis, I think, really will help us reduce improve health and also reduce obesity and chronic disease in our city. Thank you, and we look forward to your approval. Thank you.
Thank you very much. Next is Usman Kamara, if I'm saying that correctly, followed by Patty Moorbacher. Welcome.
Hello, I'm Usman Kamara. I'm a little nervous. This is my first time speaking in public like this.
Well, thank you so much for being here.
I'm with Case Darling Grocery. I'm the owner. I've been doing business on Broadway for the past 7 years, and I'm in support of the ordinance. I think this is just the perception the people have about the small grocery stores. That's why they don't come to the small grocery stores to buy this. I have customers that come to my store and buy a snack and go past my store and go down to Cup Foods and grab cereal and milk. On the way back, and I'll stop and tell them, look, I have this in my store. They'll be like, oh, we don't know you have it. It's just the perception of the customers about the small grocery stores that we don't have this. I've been doing business on Broadway for like 7 years, going to 8 years now. So I think that's the problem. The customers think we, the small grocery store owners, don't have these fruits and vegetables in our store. I think it's just the perception, and I'm in support of the ordinance. And that will help, to enlighten the customers that small grocery stores sell healthy foods too, not just snack and candy. Thank you.
Thank you very much.
Mm-hmm.
Following Patty is Jennifer Schultz.
Hello, committee members. My name is Patty Moorbacher, and I live in Barb Johnson's ward number 4. I live in Hamilton Manor. It's an MPHA housing project. It's a high-rise residence for disabled, low-income people over 50. And we have a cafeteria that serves lunch 5 days a week. It's all canned food. We have 3 to 5 carbs in each meal. This is not good. We have a food bank that comes twice a month, unless there's a holiday, and that isn't a whole lot better either. They give you yogurt, and that's about the healthiest thing that you're getting out of there. We've been worried about this, about our people getting more unhealthy. So we organized a walking club, which is great exercise with the help of the health department. And we also started a community garden for our residents. So we've got fresh veggies at least all summer that we can grow. And now they've expanded that program, so we'll have more area to be able to do that with. The closest stores to shop are Cub and Target. They're both 25 minutes away on the bus, plus a 1 to 2 block walk. A lot of our people don't have anything to carry groceries in to go that far. They don't have the money to take the bus to go more often. And it's really hard. We have a little corner community store, Camden Market, 2 blocks away from us. And I know how willing he would be to be adding these things. They need to have more advertising too, that they will have it, that they have it, so people know. Because it's a great store, but like you say, when people, they just go in there and they get chips and pop because they can get that far and it doesn't cost them anything to get there. And which, of course, this kind of a diet contributes to diabetes, strokes, and heart conditions at a cost that is critical for healthy people. And we need to make our people healthy. We need to save on health costs. The healthier the citizens are, the less health cost money is going to have to be spent. Closer, fresher food is needed. A lot of us like to cook, including myself, but it's hard or expensive to get there. And people they settle for the vending machine in our building, which is, donuts and candy bars and potato chips, or they'll walk to the little store and they'll get the same thing. And we need healthier food, more available to us. Thank you for listening to me today. Y'all have a great day. Thank you.
Thank you very much. Jennifer Schultz is next, and then Demetrius, can't read the last name. Welcome.
Good day, Mr. Chairman, council people. My name is Jennifer Schultz, and I'm represented by Councilmember Reich in Northeast Minneapolis. I am the manager of Little Kitchen Food Shelf in Northeast Minneapolis, and I'm speaking particularly for the residents in Lower Northeast. We're very interested at the food shelf in addressing food access issues and food insecurity issues, and in my position as the food shelf manager since 2008, I've seen Little Kitchen go from serving 250 individuals per month to serving more than 1,300 individuals per month, the majority of whom live in or near Northeast Minneapolis. And we know that food access issues affect all neighborhoods in Minneapolis, and that overall food insecurity has increased alarmingly over the past 6 years in our city. Lower Northeast residents live in a classified food desert, or a food swamp, if you will. The food sources primarily available to folks with limited mobility are gas stations and fast food restaurants. They live more than 45 minutes one-way trip via public transit from an affordable supermarket with a quality, appropriate selection of fresh, healthy food. We see this reality play itself out every day at the food shelf. For example, 2 blocks from us is a public housing high-rise, 1717 Washington Street, and about 5% per month of our clients are coming specifically from this address. Right across the street from them is a small convenience store of what I expect would be the non-exempt type. And I'm sure that they are providing a good service to the neighborhood, but I've been in there and our food shelf exceeds them in terms of the selection of fresh produce and staple foods and quality foods that are culturally appropriate for the folks in our neighborhood. We probably see people coming to us as opposed to going to that store because they can walk to get to us and we're very close to them. We're one of 2 sources of food for them, and it's a very compact, dense neighborhood of folks experiencing similar needs. Even though the food shelf receives no government funding of any kind, we've been able to achieve some nutritional standard for the folks that we serve. I believe that the neighborhood residents with even the most minimal buying power would greatly prefer to shop for healthy quality foods at the convenience store right across the street from them, for example, versus going to a food shelf to meet their basic nutritional needs. The demand for a good selection of fresh produce like the kind you see in front of you and for other types of healthy foods definitely exists in our community. People are not avoiding these foods, they want these foods. And we need more neighborhood grocery stores that provide these foods, the types outlined in the proposed ordinance. I support the ordinance. We at Little Kitchen Food Shelf support the ordinance, believing it would improve quality of life for our neighborhood residents. Thank you.
Thank you very much. Demetrius?
Good afternoon, council members. My name is Demetrius Harogan. I live in South Minneapolis at 623 Franklin Avenue. Zip code is 55408. I'm a noble. I live in South Minneapolis, where there's not many stores to get healthy food as presented here. And so I only want to highlight a couple of the amendments in the presentation, which is just to make sure that the work is in communities of color predominantly, I don't want them to continue to suffer, or us to continue to suffer a generational destruction of our bodies, which would help us to provide assistance to the city, of course, and being healthy members of the community to be able to work, study, and the children in the school. I'm a naturopathic doctor myself and nutritional consultant, so I see a lot of my people are sick from not being able to buy the food, so making sure also that when we're able to buy more healthy food at the stores, that it's not the most expensive thing in the store. And so making sure that it's also affordable is something that I wanted to highlight, as well as the minimum requirement to be more than 30 pounds of food for the community. Thank you.
Thank you very much. Next person is Diana Cutts, and then Vayang Mawa. Welcome.
Good afternoon. Thank you. My name is Diana Cutts. I live in Excelsior, Minnesota, and I work at Hennepin County Medical Center in the Department of Pediatrics. We see about 25,000 kids a year, and my particular specialty is in the nutritional care of children. I'm the medical director of the Children's Growth and Nutrition Clinic, and I work with a talented team taking care of those kids. We meet on Monday mornings. This morning, I saw 6 kids, ages 4 months to 7 years. Some of them were underweight, some of them were overweight. This includes a 3-year-old who was obese and already has the changes of acanthosis nigricans, the rash across the back of her neck that indicates that she's at high risk for the development of diabetes in a 3-year-old. So you might think it's strange that we address both under and overnutrition in the same clinic, but one of the things that we have learned together is that the treatment of each is very similar, and it's based in the principles of healthy food and appropriate feeding practices. So our treatment assumes that all families have equal access to healthy foods. But one of the other things we've learned is that that's not true. Access to healthy food is a serious disparity, and it affects low-income families and communities of color disproportionately. It is a root cause of lifelong health disparity. So I've worked for over 20 years with my team, one child at a time, to treat nutritional problems. But I gotta tell you, this is a really crummy model to address the nutritional needs of a community. I know only too well it will not be successful in stopping the exponential increase in diet-related diseases like diabetes that's been predicted for our children, and my efforts will not change the disease models that foretell that this generation of children will have shorter lifespans than their parents. We need to get at root causes, and we need to think outside the box, outside my exam rooms, outside the schools, where incidentally they deserve a tremendous amount of credit for all the change that they have promoted. We need to act in our communities, particularly around sites of food manufacturing, food marketing, and food distribution, including our retail businesses. The Minneapolis Staple Food Ordinance is one such action, and I urge the City Council to pass it. Hippocrates, the father of my profession, said, "Let food be thy medicine and medicine be thy food." Let's be serious about getting the right food to the right medicine to our communities. Thank you.
Thank you very much.
Good afternoon, Mr. Chair, members of the committee. I'm really glad that I had a physician precede me because I think she's going to allude to some of my points. Coming from a traditional oral tradition, I'm gonna go off my script really quickly. I just want to be very clear that Blue Cross sees this as a health equity policy, and if you are not swayed by the moral imperative to advance health equity, I hope that you'll be swayed by some of the healthcare costs and health improvement implications here. I want to be clear that I'm here in the role of the Center for Prevention at Blue Cross and Blue Shield. We are also members of the Minnesotans for Healthy Kids Coalition, and we are members of the Food Charter Steering Committee. At Blue Cross, our goal is to make the healthy choices the easiest choices for all Minnesotans. But our state is really up against a challenge. Obesity levels in Minnesota have jumped from 15.3% in 1995 to 26% in 2012. By 2020, projections suggest the figures will see nearly 1 in 3 Minnesotans classified as obese. The implications of this increase are even starker, as such a population brings with it increased risks of substantial chronic health problems. The CDC reports risks for type 2 diabetes, heart disease, osteoarthritis, most cancers, and as well as problems with pregnancy and childbirth are all highest in this population. These problems will add a projected $3.7 billion to Minnesota's annual healthcare costs by 2020. But the costs do not stop in the healthcare arena. A recent Gallup poll estimates that overweight and obese workers in the United States miss over 450 million days of work each year than healthier workers, costing businesses $153 billion annually in lost productivity. As you can imagine, these are the figures that keeps us awake at night and drives the core of our work at Blue Cross. There are well-documented factors for this. One of the most important, as you would expect, is unhealthy eating and lack of access to healthy foods. However, although the public perception is that healthy eating is simply about individual choice, factors like access to healthy options in your surrounding community play a significant role. Take, for example, the fact that residents living near supermarkets are shown to have healthier diets and are 17% less likely to be obese. That is a dramatic community-shaped health change. But that is not just a greater Minnesota issue. Right now, in large metropolitan cities, barriers to healthy choices are prevalent, with lack of access, resulting in residents from many communities needing to shop at corner stores, gas stations, dollar stores, and pharmacies where soda, chips, and candy are abundant, and more healthy options are limited and expensive. This illustrates that access to healthy foods is also a health equity issue, with white and higher income residents more likely to eat 5 times more fruits and vegetables per day compared to lower income and people of color. Strengthening the city's current staple food ordinance will help ensure that everyone has access to healthy food choices no matter where they shop or what their background is. It is about creating more opportunities to incorporate fruits and vegetables as part of their daily life and improve the diets of their families. At the Center for Prevention, we know that good nutrition is critical for individual and community health. But moreover, we need to focus our efforts on creating the community conditions that promote health. Thank you.
Thank you very much. The next speaker is Arnold Kennedy, followed by Jesse McDaniel. Welcome.
Hello, committee. My name is Arnold Kennedy. I live at 3122 Logan Avenue, North Minneapolis, 55411. I'm here to support the food ordinance staple amendment. I think it's not fair that low-income residents in my neighborhood do not have access to more variety or healthier food choices. There are more chips, sodas, and candies where healthy foods are limited. Strengthening the city's current staple food ordinance will help ensure that everybody has access to healthy food no matter where they shop. I see kids early school day morning walking from the neighborhood corner store, eating chips, snack, cakes, and pop. And by mine, our resident is closer to the store. I have to pick up the garbage. These foods will later affect their health. Having healthier food with affordability can help them maintain overall health. Some residents without adequate transportation have no choice but to shop at the neighborhood store on EBT day, buying junk at high prices, only later to be at food shelves the remaining of the month. On National Night Out, I went door to door in my neighborhood with questionnaires and listened to feedback. They all agreed there need to be affordable variety of fresh fruits and vegetables at this neighborhood store. And I want to say, by stocking healthier foods, it will better relationship between store owners and customers, and store owners can help educate residents and the kids about healthy eating. Thank you.
Thank you very much. Jesse McDaniel. Maybe Jesse had to leave. Adam Kay. And next will be Jill Clearman.
Thank you, council members. Thank you for giving me an opportunity to speak. I just wanted to tell you briefly about a program that we're piloting at the University of St. Thomas. So I'm the Director of Environmental Science at St. Thomas, and I'm an associate professor in the biology department. I do research on urban agriculture, urban ecology, and I'm developing a growing interest in food distribution. And we've come from this looking at the perspective of the corner store and other small store owners, and thinking about what we can do for them in this process to make it easier for them. We think that would ensure that this program is going to be more of a success. And it is the case that distribution options for them are limited, and particularly in their ability to get high quality, low price items in small quantities. And so we want to develop a program in order to help some of these stores gain access to those sort of resources through a program embedded in the University of St. Thomas curriculum. So we are partnering with a Community Hable Co-op, a cooperative in Minneapolis, and Fields of Joy, a small-scale produce distribution system in St. Paul. And what our operation is we have St. Thomas students pick up produce from a distributor in St. Paul, J&J Distributing, and they partner with young interns from Community Table, and they go to corner stores in low-income areas in Minneapolis. We've serviced 10 stores since July, and the store owners are able to buy quantities of produce that they would like, and we have a selection available to them. And then at the end of the run, we sell our leftover produce to the dining services at the University of St. Thomas. We have academic tie-ins associated with this program. We have a class in communication and journalism that is working with us. We have several other commitments from other departments, including our English department and our business school, to help us shore up this program over the long term. What we're looking to do is to try to create a distribution system that doesn't require external funding in order to be able to support it over the long term. We want something that's sustainable. We think that we can do this. We think the implementation of the Stable Food Ordinance is going to help us move in that direction. Thank you.
Thank you very much, and thank you for all your work. After Jill is Dylan Kesty.
Good afternoon. My name is Jillian Clearman. I live at 25 East 25th Street in Councilmember Bender's ward, and I work about a mile away at the Waite House Neighborhood Center, which is in Councilmember Warsami's ward. And while I enthusiastically support strengthening the food ordinance, as a citizen of Minneapolis, I'm really here to speak today as the coordinator of the Phillips Community Healthy Living Initiative, which works to increase access to healthy food, gardening, and physical fitness in the 4 Phillips neighborhoods of South Minneapolis. I first want to applaud the council members and all the hardworking city staff who have already done so much to prioritize health equity in our city. Minneapolis has a lot to be proud of about this, but we also have a long way to go to assure that everyone in Minneapolis has reliable access to healthy food. Previous speakers have already very clearly made the point about how important it is to have nearby access to healthy food, especially for those with limited mobility. So I'm going to skip that and just say that beyond the issue of accessibility, strengthening the Staple Foods Ordinance will help to normalize consumption of simple, nutritious foods for many people who are more accustomed to unhealthy convenience foods. Public health research and indeed just basic marketing research shows us that messages that are received consistently from a variety of sources have the best chance of actually changing behavior. And to that end, Phillips Community Healthy Living works toward a community in which healthy food is abundant in schools, in restaurants, and food shelves, in gardens, in community spaces, and at public events, and at retail establishments. So this isn't about singling out corner stores for some undue burden. This is one piece of changing our food culture for the better, and we all need to do our part in that. Strengthening the staple foods ordinance is an important step in creating a comprehensive, healthy food environment that has the power to change adults' unhealthy habits and to give children a chance to develop a lifelong appreciation for nutritious food. And so I thank Councilmember Gordon and his team for their leadership on this, as well as the Minneapolis Health Department staff. And I urge the council to approve the strengthening of the staple food ordinance. Thank you.
Thank you very much. Welcome.
Thank you. Good afternoon, Chair Gordon and committee members. I'm Dylan Bradford Kesty, 740 East 16th Street in Elliott Park. Thank you so much for your time today. I'm here today to speak in favor of the Minneapolis Staple Food Ordinance change passing. It is a step in the right direction in getting healthy food options into my community. Along with the proposed changes, we would urge the City Council to ensure equitable investments into our communities regarding food access. Also, that the City Council works to support affordability of staple food items in the stores and increase market access to local growers to support the local food economy in the city of Minneapolis. I do live in South Minneapolis in Elliott Park, right across from the Elliott Park grocery store. And sometimes I do go over there to buy some food, and it's exciting. I'm really thankful that the staple food ordinance would increase access to some of the foods that are there. But consistently in the work that I do as a community-based food system organizer with Land Stewardship Project, who also supports moving this forward today, we have conversations with members of our community. And folks say, yeah, there's some limes, and there's some tomatoes, and there's things in the stores, but sometimes they're not ready to eat. And like, I'm paying way more for them at this store than I am at someplace else. So I'm excited that this is moving forward to talk about getting culturally appropriate foods in the stores, getting affordable foods in the stores, and keeping the freshness and quality control up. So thank you so much for all your work, and thank you, Councilmember Gordon, for moving this forward. As we're moving these things forward, we'd like to think about the stores that how they currently exist have food and a lot of food-like products. And I'd like to move towards having less food-like products and more real food. And that's exciting to me. And I see this as an investment opportunity in our community. Along with the proposed changes, we'd urge the City Council to ensure the funds for stores and outreach for these things, as some others have talked about, the education in the community is an integral part of this, that it's in multiple languages and people know that it's happening. From the Minneapolis Staple Food Ordinance change, go directly to communities and stores that need it the most and where the impact will be greater. We want to see hard investments back into our communities. We also are interested in affordability, as I mentioned. We greatly appreciate the ordinance being flexible to support store owners stocking culturally appropriate foods, but please also work to support affordability to the staple food items via pricing or support smart incentives as models of the farmers markets. So I know we're not doing this yet, but I see as we move this policy forward, looking at the double up buck systems or other great programs already happen in the city of Minneapolis that if you go to the farmers market and use your EBT or your food stamps, you can actually get the double up bucks. Why can't we do this at this corner stores? Let's look into how we can do this and have that smart incentive as a policy in the city of Minneapolis to be a food leader in the country. We also want to see local food, create market linkages for urban food in the city of Minneapolis. We're excited to have increased access to healthy food and would also urge the city to consider moving policy forward that supports local urban agriculture and Minnesota farmers having increased market access connected to the staple food ordinance, truly supporting a community-based food system that is healthy, local, culturally appropriate, and has affordable food for everybody. So thank you so much for moving this forward, and I look forward to continue to work with all of you to move the city forward on food and healthy food access. Have a great day.
Thank you very much. You as well. Next is Carl Hackinson, followed by Courtney Jordan Beechler. Welcome.
Good afternoon. Welcome, Chairman. Thank you. My name is Carl Hawkinson. I live in St. Paul. Please forgive me. But I am the University of Minnesota local educator for Hennepin County, relatively new around here. I worked for many, many years, decades now, in agriculture, mostly with farmers. So I worked with farming, the tractors and the dairy cows and all that part of it. But really, when it comes right down to it, agriculture, of course, is by and large about food. And after air and water, food is what we all need. You might have paid attention the last year or so about the Farm Bill, huge government program for that got all tied up with all the shenanigans in Washington. But it is one of the few programs that has incredibly bipartisan support. If you look at who supports the Farm Bill, I challenge you to find a more diverse group. People that don't agree on anything else, support this thing because it's about food. There was a couple of congressmen got up and said, what does the Farm Bill have to do with food? Which you can't answer things like that. But so they support that, and the bigger chunk of that whole thing is the subsidies, the WIC and SNAP programs and so forth, and people have supported that wildly throughout the decades, and as I do personally, I think it's fantastic. If we can't do anything else, we should at least provide everybody with access to food. And myself, and I think most Americans, if they knew that you could take your SNAP card and go and get pop and candy and junk food, which isn't actually good for you, but because you live someplace that's all you can get, I think people would be outraged. So I strongly support this. I think it's definitely a step in the right direction. By the way, out in rural areas, there's food deserts too, where people who are poor cannot get to a decent grocery store. And it's highly ironic that they live in the middle of farm country, but they can't get a decent meal. So it's not unique to Minneapolis. So nothing is more important than health, and nothing gets you there more substantially than healthy food. And we learn our food habits when we're young, and children ought to learn how to eat real food and get a taste for it instead of this overwhelming salt and sugar that they get. And of course, we all eat and we all break bread. And what builds community and family better than bringing home some actual food and actually cooking it and actually sitting down and eating it together? So again, I just support this thing. I think it's definitely a step in the right direction. And ounce of prevention beats a pound of cure any day. Thank you.
Thank you very much. Dr. Courtney Jordan.
Good
Welcome.
afternoon, members of the Health, Environment, and Community Engagement Committee. My name is Dr. Courtney Jordan Beckler. I live in Edina and work in Minneapolis as Vice President of the Penny George Institute for Health and Healing, part of Allina Health. I'm speaking to you today as a practicing cardiologist and a volunteer with the American Heart Association. To achieve or maintain heart health, the American Heart Association recommends that people strive to get at least 4 to 5 servings of fruits and vegetables each day and consume more whole grains as part of their regular diet. While we all try to achieve these goals, it can be easier for some of us than others due to accessibility and affordability of these healthier foods in our community. When I consult with patients, I can make these recommendations to eat more fruits, vegetables, and whole grains. But if my patient has no access to these foods, then my recommendations cannot be acted upon. I'm asking them to do something that is not within their control if they do not live within near a store that provides healthy foods. Let me give you a personal example. One of my dear patients, Sarah, who is a 45-year-old woman, 3 children, a single mom, unfortunately has suffered a myocardial infarction or heart attack. I can do everything possible, put her on every guideline for medications, and then tell her the best evidence we have that diet is one of the most important things she can do going forward, but she has no access living on the north side to healthy fruits and vegetables as a woman who's trying to single parent, raise kids, and work at the same time. Unfortunately, I regularly see the results of unhealthy diets in my practice: high cholesterol, high blood pressure, diabetes, obesity, and most tragically, lost life due to heart attack or stroke that absolutely could have been prevented if they'd eaten a healthier diet. Obesity and unhealthy eating also have an impact on the rising costs of healthcare. In 2004, Minnesota experienced $1.3 billion in obesity-related healthcare costs, and Blue Cross Blue Shield in Minnesota anticipate those costs to be $5 billion in 2020. That's why I'm so pleased to be speaking to you today. I was thrilled to learn that Minneapolis is considering this key pivotal step to enact a stronger ordinance that will remove a key barrier for many to eating healthy. There are certainly enough barriers to eating healthy, as we all know. Proximity to healthier food is a barrier that can be addressed. I urge you to support the proposed changes to the staple food ordinance before you today. Thank you.
Thank you very much. Next is Ava Metz, and then Allison Charlery. Maybe we can go right to Allison. Oh, there's two Allisons, sorry.
Hi, committee members. I'm Allison Sharkey, Executive Director of Lake Street Council, and I wanted to say thank you very much to all of the staff who were working on putting together this amendment, for really hearing from business owners in the community that will be impacted by this. There are a number of changes that were made that are important changes to make this work. Food access is important to our neighborhood, and we want to help make the most workable ordinance that we can that works for everybody. So some of the changes that have been made based on feedback from business owners has been some changes to make sure that we allow for cultural appropriateness in food selection. Also reduction of numbers of things like boxes of cereal and containers of juice, which means that the same products will be available to shoppers, but requires people with limited space to have to carry, make less space for these items. Business owners had gotten together and requested that materials be available in multiple languages while the ordinance was still under debate rather than afterwards. So we appreciate that that those were made available as well. A couple issues that we feel like are outstanding after having talked to a couple dozen business owners. For most business owners, they carry WIC already, so there's no problem at all. The accessory grocery definition still seems a little bit unclear. We're wondering about what constitutes a specialty grocery. If you do imported foods, halal foods, all local foods. What if a business owner, when they're first applying for their license, applies under a regular grocery license, but they are actually more in the specialty category? How are they impacted if they're not really intending to sell general groceries? What was the other one? The second one was if it's just not working for a grocery store. I think from what we've seen from the university's study, it seems like it should work fine for most people. If it's not working, for example, you're in, a food court, a mall kind of situation, you're selling one kind of thing, the person next to you is focusing on selling produce. So selling produce is just not really working for you and you're throwing stuff away. It would be nice if there could be some kind of exemption. I'm imagining what would happen is that there would be kind of an agreement that enforcement just wouldn't happen. But it's always nice to have that clarified up front. So those were our questions, but overall, thanks a lot for inviting business owners to participate in the discussion and really hearing from them. Thanks.
Well, thank you, and thanks for your willingness to help facilitate those discussions. Next is Anna Clevin, followed by Mickey Taylor.
Good afternoon, council members. My name is Anna Clevin, and I'm a resident of Longfellow neighborhood and a junior at South High School. This is my second year on the Minneapolis Youth Congress, in the Transportation Committee, and on the Tobacco Initiative. I've gone to Minneapolis public schools since kindergarten. Back in elementary school, people from the nearby Seward Co-op would bring in fresh food for us to try. Many of my classmates didn't know the names of the foods or where they came from. I encountered a similar situation this summer while working with kids in lower income communities. Part of the program involved harvesting vegetables from a community garden and making a salad on site. I had about 8 groups of kids, and every single week the kids were shocked to see that their food came out of the ground and not a bag. When I began 9th grade at South High, I found that they offer a wide variety of fresh and non-traditional foods for lunch. And every day I see my classmates with plates full of fresh food and vegetables. And fresh food is made available, and the results of this are clearly seen in the eating habits of my peers. I know that making fresh food accessible does cause changes in healthy eating habits, and I hope you all support the changes. Thank you.
Thank you very much. I'm not sure if I'm pronouncing this right, but I think it's Mickey Taylor, and then followed by Owen Casey.
My name is Makai Taylor. I'm a senior at South High School, and I'm also in the Minneapolis Youth Congress on Tobacco Initiative and the Safety Committee. I live in Northeast Minneapolis, and I have access to several places that sell fresh produce and other healthy foods. I can drive, bike, or even walk if I really wanted to. The problem I see is that some people do not have access or the same easy access as I do to get to the stores like those that have fresh produce and healthier foods. This affects the quality of the food that they're putting into their bodies, which makes them unhealthy. If the only stores nearby are small corner stores or convenience stores that sell mainly junk food and not as many healthier foods, the person or family will be stuck with those or what is convenient for them, and they're limited to unhealthier foods and junk food, and this can lead to a lack of nutrients that are important for their bodies. Again, my name is Makai Taylor, and I support the updated Staple Foods Ordinance. Thank you.
Thank you so much for being here and for your service on the Youth Congress. Owen Casey is next, followed by Allison Meyer, and then Akeisha Everett is the last speaker signed up. Welcome.
Good afternoon. My name is Owen Casey. I'm a junior at Minneapolis South High School, and I as well live in South Minneapolis at 3416 40th Avenue South. I'm a member of the Minneapolis Youth Congress. I'm going to my second year on the Transportation Committee, as well as in the Tobacco Initiative. I'm here in support of the proposed changes for the ordinance, specifically raising the minimum from 4 to 10 groups. When I go into my local corner stores or even some of the gas stations, there are a few healthy foods provided, but not enough for a family to make a meal. And many low-income families in my neighborhood rely on these corner stores and sometimes even the larger gas stations, such as like a Holiday or a Super America, a chain, for their food. And they don't always have access, like Makai said, to a larger grocery store. I also notice in my community that many of my friends are athletes, and as we grow older, we get more and more serious about the sports that we take part in and our health. And I don't often see many healthy foods become available for myself and other athletes looking to have a healthy diet. It's often, if we can't find something to eat, we have to resort to a vending machine or a bag of chips that we find at one of these gas stations or corner stores. And if we raise the minimum food groups, there's going to be a wider variety of healthy foods for us to choose from to eat, as well as for low-income families to create a meal for their family. So I would just like to say I really do think that it would be a good idea to raise the minimum, and I support all the other changes as well. Thank you.
Thank you so much. Allison Meyer.
Good afternoon, council members. Thanks for the opportunity to speak today. I'm Allison Meyer, and I represent Seward Community Cooperative. We operate a full-service grocery store on East Franklin Avenue in South Minneapolis. We support the proposed amendments to the city's current staple foods ordinance because the ordinance revisions would help improve healthy food availability in Minneapolis. The more than 12,000 households that own our cooperative believe that the food we eat significantly impacts our health. Seward Co-op's mission is to sustain a healthy community with inclusive, socially responsible practices. The changes to this ordinance will support that broad aim and ensure that everyone has access to healthy food choices, no matter where they shop. We recognize that there may be challenges as stores learn to meet the new requirements, but we are confident that residents of Minneapolis desire access to healthy foods and will demonstrate their demand for these options and contribute to the store's success over time. We strongly support this policy change and hope that the City Council will also show their support by adopting the proposed changes. Thanks very much.
Thank you very much. And the last speaker on the sheet is Akeisha Everett. Welcome.
Hello.
My name is Akeisha Everett, and I am a resident of North Minneapolis, particularly Falwell neighborhood. I live at 3311 Logan Avenue North. I work in Minneapolis. My kids go to school in North Minneapolis. So we have a vested stake in North Minneapolis. And with that being said, we have a corner store gas station a block away from my house that has a grocer's license that could clearly be licensed for probably a specialty store that sells tobacco, like tobacco specialty or maybe a chip specialty place. It definitely doesn't have groceries in there. And I figure that this ordinance is kind of a no-brainer. It's like if you accept SNAP benefits, if you accept WIC benefits, you should be selling some kind of grocery, right? My children are getting older. You know, I have, like that young man said, he's an athlete. He wants to be able to venture off and go to the corner store for snacks and be able to, oh, I have $2, can I go to the store? That's not a possibility with the choices of food that they have. Also, with the variety of tobacco products, it brings another safety concern as to why I would let my son be in a gas station that has that many products. So I am very much in support of the staple foods ordinance for those very reasons. I would love to be able to go into their store and pick up some stuff for dinner, you know, some eggs, some milk, so just some basic stuff, you know. I think that if any one of you guys came into that grocery store or that corner store or whatever they classify it as, it would be an outrage. It would just be an outrage. So it's a health disparity in my eyes. Thank you.
Thank you very much. There's nobody else signed up to speak. I don't see any other speakers here, so I'm prepared to close the public hearing unless somebody else wants to speak. Yes. Please state your name and address for the record.
My name is Christy Clemens, and I live at 3052 11th Avenue South in Minneapolis. And I work as the food justice organizer at Hope Community in the Phillips neighborhood, where we're currently engaged in a project where we're talking with over 400 people in Phillips about food and food access. We're over halfway through the project, and a number of people have said that they'd like more access to fresh produce in their neighborhoods. Many of them commented that they have to travel outside the neighborhood to get the food that they want to be healthy, that food being fresh and affordable produce. Speaking for myself, I'd love the opportunity to support the corner stores in my neighborhoods and the neighborhoods that I frequent on a more regular basis. But currently, I too have to travel outside of the neighborhood to get most of the food that I need to be healthy. If I could buy that same food near me, it would not only save me time, it'd support me in building a relationship with stores in my area, and they'd receive more of my business. That being said, I do support corner store owners in having a smooth transition as this ordinance passes, as I would hate for stores to have to close and make room for gentrification because of the ordinance. It is still important for me to have fresh, affordable produce at corner stores, and it's also an opportunity to close the equity gap between low-income people of color and whites. It can help to lower rates of obesity, diabetes, high blood pressure, and heart disease for many people in my community. So that's why I support this ordinance. Thank you.
Thank you very much. One more, briefly. Oh, two more.
Hi, thank you for taking my comment. I live on 2929 Chicago Avenue, South in South Minneapolis. And I also work with a lot of the people who have come and spoke today. I work with the corner store owner who talked about people passing his store and going onto the grocery store and wanting to shop there but didn't know. I work with the professor and the organization through St. Thomas that helps distribute groceries like in this quantity as opposed to what distributors usually require, cases and multiple cases that, would not really fit in people in corner stores. And so I am already supporting a lot of the movement that's going with the food, staple food ordinance, and working to be able to get these fruits and vegetables in the corner stores, working with the corner store owners to understand where the customers are coming from, how they might not know that they have the fruits and vegetables there and they have all the things to make dinner there, and working to make that something that they want to do. And a lot of corner store owners do want for this opportunity, but I also do see it as an opportunity for them to have hardships. So even when they are taking out loans to have new refrigeration, to be able to display these foods, to be able to keep them fresh, that, just one refrigerator breaking, which has happened with one of our corner store owners, would really set them back a lot. And this is also not coming from within the store's decisions, so it's something that's being imposed on the store and the community, which can be an asset, which can be a really good way to have people and corner store owners connecting, being able to know, yeah, we do have this whole tray of stuff that you can make, use for dinner. And then the next time they'll come back. But until then, I see it as being able, as potential to be a hardship to corner store owners. So I do hope that we can work to implement things like we have within our program, Fresh Fridays. Every Friday they get, buy one, get one free, and we supplement that for the corner store owners. I worked all summer at the West Broadway Farmers Market, working with people, to talk about so tomorrow, you don't have your WIC or EBT today. Tomorrow you can go to the corner stores. And so, even something like avocados, this is what you can do with avocados. Just having the conversations with them and not it be, a checkout line at the grocery store. A lot of the people who had WIC coupons didn't even use them. They had them since last year. They have had their whole book since last year. So sometimes when these ordinances and when these laws and rules are being changed and just set in, people are still not getting the access. And so I just want to make sure that we're working to make that a smooth transition. And as far as having staff to work on it, this is something that we've been working on within our organization, Appetite for Change in North Minneapolis. And so there are people in support and there are people that are there to help. So I thank you for doing this today.
Thank you very much. And our final speaker today, state your name and address for the record.
Thank you, Mr. Chair, for the opportunity to speak. My name is Lisa Boyd. I live at 3618 East 38th Street in South Minneapolis in the 12th Ward. And I also work for Second Harvest Heartland, which is one of 5 food banks in the state of Minnesota that covers 41 counties, including Hennepin. And so we work with many of the food shelves in Minneapolis to provide donated food products to them so that they can distribute to individuals in need. And I wanted to speak today in particular support of the choice that Kristen and her cohort made to look to the WIC standards in order to develop an appropriate list of staple foods for the city of Minneapolis, as opposed to SNAP. SNAP, the Supplemental Nutrition Assistance Program, is provided to individuals of all ages based on their level of income. And aside from the fact that it's intended to cover food products, there really are no particular nutritional standards assigned, except that you can purchase food with them other than non-food. And so, again, I just think the WIC standard is a far more appropriate standard to use for that reason. Thank you.
All right, thank you very much. I appreciate all the speakers who came today. I'm going to close the public hearing, and I'm going to move the staff recommendation and the ordinance as proposed. And I see some discussion. Councilmember Glidden.
Thanks, Mr. Chair. And I do want to say thank you to your office and staff. I think there has been a lot of work that has gone into this ordinance clearly, and also some adjustments, which I think were intended to help better ensure that the ordinance could be complied with. Would not impose unreasonable burdens on what are clearly some small business owners. I appreciate as well that so many people came to testify today and also reflected their support. I know the folks from Youth Congress have left, but I was especially happy to see them here because I've worked with the YCB before on the Youth Congress, and I'm glad to see them engaging in policy discussions. Although I don't know the coordination with transportation and tobacco, but anyway, that's maybe another question. So anyway, a lot of engagement on this, a lot of positive support. I am going to be supporting these ordinance changes, but I did want to reflect some concerns about the ordinance. So maybe just, again, food for thought. And I appreciate, too, staff answering my questions here in committee, and I'd also forwarded some additional questions that staff took the time to respond to in writing to me. So I really wanted to make sure I was understanding the ordinance. I appreciate the intent of the ordinance, but I think from my perspective on how our original staple food ordinance has been rolled out, that these work around asking stores to carry certain products does not always mean that you're going to get the result that the community sees those products or is attracted to those products in those stores. And I just say that because just having the products doesn't solve a marketing problem. It doesn't necessarily solve a problem of how do you get the products with, you gotta source those products. And if you're a small business, it is often difficult to figure out, how am I gonna get those products? And I only need so much because I don't have a big space to put them, so I can only buy so much. Anyway, there are a lot of challenges for a small store in how are you going to stock the products, make sure they continue to be fresh, try to advertise to the surrounding community so they're going to actually come in and buy the products. So it kind of says there's this whole support system that needs to happen around the stores. It's not just saying that you stock the products. And so I just want to be clear about that. The other thing is that I think this is a challenging ordinance. It's really, just to me as kind of the layperson, it's a pretty complicated ordinance. There's a lot of combinations that could combine to show compliance, but the products aren't necessarily going to be in one section of the store. They're going to be placed in multiple sections. And again, that just says there's going to be some complications to how do we work with those stores? How do we know that they're complying? What's the enforcement look like? And so, I mean, again, this says how are we going to really make sure that we have a good system around this. Last, I want to say this definition about the accessory use grocery. I've had a little back and forth actually even during the committee with some staff and staff from Councilmember Gordon's office about some of the history around the changes and what was intended with the changes. So some of that has helped make sense, but I do agree there's still seem like there may be some challenges to understanding what all might qualify around these specialized types of classes of staple foods. I guess that's the section where there's some questions about how that might be interpreted. And then I don't see our general business licensing folks here, and I think they're going to have a role. Who is here from? Oh, there's Mr. Wilson. So I'm not clear on what's been the role of business licensing in looking at how are we removing certain definitions and then replacing them with another definition, and then does that make sense overall with how our ordinance system reads? And so this is kind of getting down in the weeds, away from the issue of how the broad intent of the ordinance will play out, but more with have we really carefully looked through all this? And I just say it's because we've only heard from our health professionals. We haven't heard from business licensing. And so I just, and it wasn't a question we went into. So I'm not asking Mr. Wilson to come here. I'm just saying I'm not clear on how this is playing out from this point. And I think we do need to be clear because we have multiple departments that work to enforce these ordinance systems. And we want to make sure that they're clear so that our own staff understands them well, because our own staff are the ones that then enforce them and educate the business owners and work with them to ensure compliance. So, so anyway, that's it. I'm supporting the ordinance, but I did want to put some of those things on the table, and thank you.
I appreciate those concerns. I don't see any other, Councilmember Johnson.
Thank you, Mr. Chair. I just wanted to say thanks to you and staff for drafting this. I think it's a wonderful change and amendment. I also want to thank everyone who came here to speak today in support of it. With a lot of our ordinances, they can certainly be improved upon, and so I think that certainly taking in some of the concerns that we've heard today as we work to implement this, there may be opportunities to improve this. I know one I mentioned was just in conversations with staff around fresh fruit in terms of how we define fresh fruits and vegetables, making sure we have a strong enough definition, because I go into my grocery store that takes pretty good care of their fruits and vegetables, and I can't find an avocado, for instance, that would pass for my guacamole recipe. So I think we have opportunities there to refine that, to ensure that we're meeting those expectations so that people can reasonably get fresh produce every single time they go to the store. But with that, I just want to say thank you again, and thanks to everybody. I think this is a great step forward in our city.
Well, thank you very much. And I also, I'll just note that we actually tried to strengthen the language of perishable items and define it a little better, thanks to your comments earlier in a briefing meeting. So appreciate that. And I'm also open to looking at other possible amendments. If we get something that really clicks with accessory use, I think between now and the council meeting, there's some opportunity that we could maybe refine some of this. I also think that implementation is going to be key, and I think that we'll have a chance as we're implementing it and after we've tried it and after we get our study back to make further improvements. So I'm going to call for the vote on this. Seeing no other comments, all those in favor say aye. 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 Any opposed? All right, that motion carries. Thank you very much. We do have one more item, which I'm hoping is a brief item since I booked myself. And I believe that the presentation is getting set up for that. And this is on short-term food permits. Maybe Mr. Huff will start us out. And then I believe we're going to have a presentation from Ms. Beard. Welcome.
Thank you, Mr. Chair, council members. My name is Daniel Huff. I'm the Director of Environmental Health. I would like to just point out that we had a revision on the staff letter or the request for council action, just clarifying the fiscal impact of this. As we were dealing with fees, there is a fiscal impact. However, there is not a net impact that we would project for city revenue. But I am going to turn it over to our presenter today, Janet Beard.
Thank you very much. Welcome.
Thank you, Mr. Chair, council members. I appreciate you having me here today. My name is Jana Beard. I'm a health inspector with Environmental Health's Food, Lodging, and Pools team. And as you can imagine, I work with short-term food permits and have had the opportunity to be involved with rewriting some of the language of the proposed ordinance. I appreciate the fact that you've been here much longer than expected today, and I'm going to try to condense this and summarize. So please stop me at any point if you need additional information or clarification. The changes, of course, will be to Title 10, Chapter 188, 170. There will be three components to the changes. The first and most significant is that we're proposing that we create an event sponsor permit. Right now in the city of Minneapolis, every event has an event sponsor, and every food permit is issued in the context of an approved event. So we already have event sponsors for all of our events. Right now they fill out a 2-page application form in which they state who their invited vendors are, and they sign off that they've received from us, usually by conversation as well as written material, the expectations of food safety. What we're proposing is that we make that an actual permit. In doing so, we believe very strongly that we'll gain better stakeholder involvement from those sponsors, a way of identifying them and tracking them better. And along with that, there will be a graded fee scale that is instituted. We started the base cost at $87, which is the identical cost of a short-term food permit. And it's scaled up for the larger events. We felt that this was an equitable way to address the work that we do in helping to provide food safety to the events in the city of Minneapolis through education and consultation, as well as through the inspections that we provide. So events that have 10 or under vendors will have just that base cost of $87. As you can see from the slide, the larger ones would have 2 and 3 times that amount, capping at $261. We want to point out that that event sponsor permit will include the cost of one short-term food permit. And that's significant for the many events that we have throughout the city where the sponsor and the vendor are one and the same. Take, for instance, a church that has a fall event for the public, and their church members are also the ones preparing the food and serving it. So the cost would then be on the side of the sponsor permit rather than the short-term food permit, but it would be the same cost. And finally, and possibly most significantly, this new permit would allow sponsors who have vendors who meet a very specific criteria to list those vendors all under their own permit. And this will be especially applicable to events that are serving wine or beer, like in a sampling situation. So the specific criteria that we would work through as sponsors are presenting their information is that the drinks would be not potentially hazardous. Beer and wine would certainly fall into that category. They would come from a bottle, a keg, or a can, and they would be poured without garnish and without ice. And that is a category in the world of food safety that really falls into a very low risk category. Those aren't folks that we need to overly charge when we're assessing their permits, and they're not folks that we need to inspect overly much. So in other words, the sponsor would be able to take responsibility for a good portion of their vendors if they have vendors that meet that criteria. For example, in a wine event where there were 50 wine vendors coming in to do sampling, 2 food permit vendors, under our current system, 52 permits at the cost of $87 would be prohibitive. It's over $4,500. It's probably one of the reasons why some of our folks don't seek out for food permits, which they really should be. Under the newly proposed system, the event sponsor taking charge of those 50 wine vendors would pay just $261, and then the 2 food permit vendors would be accounting for a cost of $174. So as you can see, $435 in that situation, we feel is a lot better representation of what it will cost us to run through the food safety facts with them, figure out the details of the permitting, and then also do the inspection at that event.
Councilmember Johnson has a question.
Thank you. Just a quick question, back a slide. With the 2 vendors times 87, would they still get that 1 food license free? So would it actually be less than $435?
Mr. Chair, Councilmember Johnson, that is correct. Yes,
Thank you.
Thank you. You're absolutely right. That is very correct.
Good catch.
Changes that we have to adjust to. So the event sponsor permit will allow us to conform to state statute and meet our obligations of our delegation agreement by making sure that people who vend food or drink in Minneapolis are permitted. It will provide a better way of fostering sponsor responsibility. We believe that we're making the fees more accurate to the work that we do as health inspectors and also more equitable across the board. And we believe strongly that we'll be increasing efficiency, both on the end of the sponsors who are organizing the event, the vendors who are needing to fill out the application materials, and for ourselves in going through the high volume of application materials that we get mid-spring through mid-fall, because we won't be having to sort out those vendors that really are in such a low-risk category with beverages like beer or bottled water or Gatorade. They'll be able to kind of be off on the side right underneath the sponsor's permit. That essentially summarized the first component of the changes we're proposing. The second component we're proposing is quite simple. It's that we would increase the current late fee, which is 50% of the permitting fee, up to the full $87, in essence doubling the permitting fee. The reason for that is not to obtain more funds. The reason is explicitly to try to provide an incentive to get sponsors to submit their materials on time. Mid-spring through mid-fall, we're just inundated with applications. Makes it really hard for us to take the time that we need to go through those applications, fill in the blanks, contact vendors, find out where there are, higher risks, make sure that they have the right equipment, and even prepare for inspections. When we have weekends where dozens of events are going on around the city, we need to be prepared to have brought in staff during the weekend hours. And it takes a good number of days to bring large sponsors and large events through this process. So we really want to provide an incentive for people to get their material in on time. Right now, there are a lot of folks who are quite comfortable with paying the $43.50 late fee right up to the last minute. The third and final component of the changes that we're proposing to the ordinance today are specifically in regard to the Minneapolis Convention Center. The folks at the Convention Center are exceptionally experienced in event management. They have been a very committed partner, and as we've been going through the process of looking at what do events and what does food permitting in Minneapolis look like as we go into the future, they've become even a more committed partner. They have event coordinators for every single event that they have at the Convention Center who are really partnering with us to do a lot of what we do. So they work directly with the sponsors and they work with us as well. We've had some face-to-face meetings. They've provided all of their contact information. We're expecting really good cooperation as we go forward. Even they've purchased hand sinks that are available for event sponsors to rent on behalf of their vendors so that that component of food safety can be taken care of. And because they're doing a lot of that coordination at the start of the process, as we go through the permitting and even meeting with us on site and taking care of details when we inspect, we feel that it's appropriate to reduce that fee to reflect the amount of work that we're doing in permitting events at the Convention Center. So we therefore are proposing that those fees for events at the Convention Center be reduced by 50%. That concludes the details, and Director Huff and I are both available for questions.
I don't see any questions right now. We are going to have a public hearing on this because it's an ordinance amendment. So I'm just going to quickly open the public hearing. And is there anybody here to speak on this matter? Then I'm going to close the public hearing, and I'm going to move approval. And thank you for your wonderful presentation. And on that motion, Councilmember Johnson.
Thank you, Mr. Chair. I think it makes a lot of sense. I think it's exciting for our small businesses. I do have a slight concern around, and I think it's good in theory, around the discounts for the convention center, only because I would say that that is something a lot of people can say. I think the Hilton does a lot of events. They have a lot of sponsors and vendors in there, and I'm sure they are quite experienced with food preparation as well and help out with those sponsors and those vendors and have additional facilities as well to provide. And I can say that of several businesses within my ward as well, who I know regularly go and attend events around our community and set up and sell food, and they know how to do this. They do it all the time, and they're experienced, and I think at this point, they're pretty trusted with it. And so I guess that's my only concern there, is that it could potentially create it's good logic, and I think it applies much wider than the convention center. So I would be interested if there's any response to that from staff, if we're looking at maybe expanding that beyond, and how we can best apply that.
Mr. Huff.
Mr. Chair, Councilmember Johnson, it's an excellent question. This is actually based upon precedents that we have with some of our other permits where we actually issue to city departments at half cost our after-hours work permit, for example. Public Works receives that permit at half cost, really for two things. One is it's all one city system, we're paying ourselves. But also because we are in the same system, we are all city departments, we just have a much closer working relationship, and we're able to rely more upon them as city officials to help us enforce our rules as well.
Thank you. That makes a lot of sense, and I hope that in the future we continue to look for opportunities to extend that same kind of capability to folks in the community. I know we have a pizza shop that constantly shows up at events with the pizza already made back in their facility that we already looked at, and they're just handing over a slice of pizza on a piece of cardboard. They do it all the time, and I know every time they have to be inspected, and especially they have the same people, same events they're going to, same pizza, all that kind of stuff. So I'd like to make sure we can help them out if we have opportunity to as well. Thank you.
Appreciate that. Maybe this will set us on the trend. We've at least identified some super low risk opportunities here to deal with. So on the motion, all those in favor, please say aye. Aye. Any opposed? That motion carries. Seeing no business beyond that, we've concluded our meeting, and this meeting is adjourned. Thank you so much, everybody.